The 9 early warning signs of a kidney disease crisis. In this video, we will discuss what to look out for to maintain healthy kidneys. Your kidneys are approximately fist-sized bin-shaped organs. Kidneys have multiple functions. One of the most crucial tasks is assisting the body in eliminating toxins. Your kidneys filter your blood and eliminate waste items through urine. The kidneys are among the most important organs in the body since they are responsible for the filtration of waste, the production of red blood cells, and the maintenance of bone density. When the kidneys do not function properly, waste products accumulate in the body. Without treatment, you will become ill and eventually pass away if this occurs. Top 9 warning signs. 1. You're experiencing trouble sleeping. Toxins stay in circulation rather than being removed by urine when the kidneys are not working normally. This can make it difficult to sleep. Obesity is also connected with chronic kidney disease, and people with chronic kidney disease are more prone than the general population to develop sleep apnea. If left untreated, chronic sleep problems can negatively impair your quality of life. Your reaction time may decrease when driving, hence increasing your accident risk. Additionally, little sleep may impede your effectiveness at work or in school. In addition, it may impair your immune system, leaving you more prone to colds and other diseases. Consult a doctor if your sleeping troubles become persistent. Your physician can recommend multiple treatment alternatives. 2. Your skin is itchy and dry. When healthy, the kidneys conduct a variety of crucial processes. They aid in the creation of red blood cells, the preservation of healthy bones, and the maintenance of the right mineral balance in the blood. When the kidneys are no longer able to maintain the right balance of minerals and nutrients in the blood, dry and itchy skin may be a sign of mineral and bone disease, which generally accompany the severe renal disease. An excessive amount of urea in the bloodstream due to a faulty kidney can produce intense itching, which is a serious sign. Individuals with renal impairment are prone to acquiring rashes. This rash is caused by decreased renal function. The accumulation of waste in the blood is responsible for skin changes and rashes. Uremic pruritus is a highly itchy skin condition caused by renal failure. 3. You experience increased fatigue. The accumulation of toxins and pollutants in the bloodstream can be caused by a substantial loss of renal function. Anemia is a result of renal disease, which can cause weariness and weakness. Erythropoietin is a hormone produced by healthy kidneys that urges the body to manufacture oxygen-carrying red blood cells. As kidneys degenerate, less EPO is produced. Without enough oxygen-carrying red blood cells, muscles and the brain tire quickly. The kidneys eliminate waste from the blood and excrete it as urine. Toxins can build when the kidneys are not functioning properly. A typical indicator is a fatigue. You may experience fatigue, weakness, and difficulties concentrating. A hormone produced by the kidneys urges the body to generate red blood cells. 4. You have to urinate more often. Frequent urination, especially at night, might be an indicator of a kidney disorder if it occurs regularly. When the filters of the kidneys are weakened, urination frequency may increase. This may also signify an infection of the urinary tract or an enlarged prostate in men. There may be an issue with your kidneys if you use the restroom more frequently than normal. If the kidney filters are impaired, nocturnal urination may result. Given that frequent urination is associated with illnesses such as diabetes and urinary tract infections, this symptom necessitates a visit to the doctor. Before we get into the rest of the list, be sure to give us a thumbs up, subscribe to our channel, and ring that notification bell. 5. Back pain. Back discomfort is one of the first indicators that you may have kidney disease. Since your kidneys are located higher up in your belly between your ribs, a kidney infection can produce severe discomfort in the middle to upper back. This pain may also migrate to the belly and groin, depending on the degree of the infection. Small kidney stones frequently move through the urine system painlessly. However, larger stones can produce a sharp, excruciating pain that normally develops as the stone travels from the kidney to the ureters. The ureters are tubes inside the urinary system that link the kidneys to the bladder. 6. Difficulty breathing. Shortness of breath can develop if your kidneys are not adequately filtering and excreting waste materials and fluids, particularly if the fluid has accumulated in your lungs. Moreover, anemia, a lack of oxygen-carrying red blood cells, can result in oxygen shortage and shortness of breath. Lungs can swell due to an excess of body fluid. This buildup, when combined with anemia, can induce shortness of breath. Your organs create insufficient levels of the hormone erythropoietin when you have renal disease. The hormones direct the production of red blood cells by the body. In its absence, anemia and shortness of breath may develop. You may experience trouble breathing. In extreme situations, resting on one's back may produce a sense of drowning. 7. Blood is visible in your urine. Blood cells can leak from the body into the urine if kidney filters are damaged. In addition to renal illness, blood in the urine can signify tumors, kidney stones, or an infection. The kidneys create urine, thus if they fail, the urine may change. Foamy urine may be a sign of albumin, a type of protein, overdose. This may result from kidney troubles. 8. Migraine and headaches. As hypertension increases and elevates the pressure in arteries throughout the body, you may experience a rise in pressure in the arteries of the brain, which can cause headaches. Moreover, the accumulation of toxins in the body can affect the brain and lead to confusion. Migraines are severe, persistent, painful headaches that are frequently accompanied by nausea, vertigo, or the perception of flashing lights or blind spots. Consequently, several mental and physical difficulties resulting from these symptoms. Multiple pieces of evidence indicate that migraine is not a localized disorder. It can escalate to chronic hypertension and kidney disease. In addition, headaches are common in individuals with chronic kidney disease, and 40% of hemodialysis patients suffer from migraines, suggesting a link between migraines and chronic kidney disease. 9. High blood pressure. One of the leading causes of renal disease and ultimately kidney failure is hypertension. Kidney filters and blood arteries are both at risk from hypertension. The heart needs to work too hard to pump blood if this force is too high. Long-term damage to blood arteries caused by high blood pressure has been linked to major health issues like renal failure. Caring for your kidneys should be a primary priority. The best thing you can do to maintain healthy kidneys is to live an active, health-conscious lifestyle. Consume nutritious foods, exercise regularly, and avoid smoking. If you enjoy this video, you should watch this other video. The 10 foods that can help you avoid kidney disease. Take care of yourself.